she feels hopeless and helpless. Immediately, we can find out the problem. The patient is actually having post-stroke depression. The problem that cannot pick up by a usual doctor, but a touch from a geriatrician can open up the patient's heart immediately. Hi, I'm Dr. Teh Hoon, a geriatrician from Sunway Medical Center. My role is to treat older patients holistically, not only look at their medical problems, but also look at their physical function, intellectual function, emotional well-being, and social support. The reason why I chose to become a geriatrician because I was inspired by my ex-national head of geriatric medicine, Dr. Lee Fat Soon. I still remember there's an elderly lady admitted during that time. She's a stroke patient. Her stroke was not too bad, but her recovery is not up to expectations. We don't know why. Her blood test is normal, her vital signs is normal. Me, the nurses and the therapists, we asked her any problem? She said no problem. But we just couldn't find out why she's not engaging with the rehab activity. Until Dr. Lee, he came for ward round. After he listened to our story, he just walked to the patients, squat down and talked to her at her same level, touched her gently and asked her, "How are you today?" Immediately the patient cried, opened up her heart to him, tell him that she feels very sad. She's disabled now. She worried that this might burden her family. She feels hopeless and helpless. Immediately, we can find out the problem. The patient is actually having post-stroke depression. The problem that cannot pick up by a usual doctor, but a touch from a geriatrician can open up the patient's heart immediately. This is why I want to become a geriatrician. A human touch is very important in medicine practice, which cannot be replaced by technology nowadays. For example, let's say an elderly lady, she was admitted for hip fractures after a fall. She has underlying diabetes, hypertension, and also heart disease. And prior to the fall, she is independent. She can cook and do house chores. So for usual scenario, the patient will be admitted under orthopedic surgeon, and then they get the fracture fixed and discharge the patient. But for geriatricians, we will look into why the patient has a fall. There are many reasons can lead to the fall. For example, maybe the vision problem, maybe the foot cannot feel properly when she walks, maybe the heart disease which can lead to the fall. We try to correct the problems, and then we also will strengthen the bone. If the patient has osteoporosis, we will treat it to reduce the risk of fractures in the future. On top of that, we will try to rehab the patients, try to get her back to the previous function as much as possible. Geriatric giants are the common problems that faced by elderly people. There are 5 I. Number 1 is intellectual impairment, which means forgetfulness, cognitive issue. Number 2 is instability. It means recurrent fall. Number 3 is immobility, difficulty in walking. Number 4 is incontinence, urinary or bowel incontinence. Number 5 is iatrogenicity. It means the patient suffers from side effect or complications of treatment. If you or any of the people that you know suffer from any of these problems, it is advisable to see a geriatrician for further assessment and management.